had her on the adjusting table. I was adjusting her, and she gets up and she goes, oh man, my sinuses every morning are just congested. What can I do to help ease this up? So one of the top medications that we run into and that many of you have probably used is ibuprofen, aspirin, to relieve joint pain, relieve discomfort, relieve inflammation. They can be useful in short-term relief, but over time, these medications can wear down that protective mucosal layer in your stomach and in your intestines. Welcome back. Dr. Matt here from the Freedom Health Show. And we are now slowly moving over here to Spotify and Apple Podcasts. Okay. Now, let me explain to you why we're making this move. Our goal is to make this easy for you to find us, easy for you to listen whenever and wherever you want. Our goal is to help empower you and give you tools and knowledge to take charge of your health. By moving to a podcast only, bottom line is we can reach more people. We offer you deeper content. We can ensure that you have easy access to every episode. You can get it in your car. You can be listening to it as you go to bed at night. You can listen to us wherever you want. So you can build a stronger connection with us, your health, and get the content you need in order to live a healthier, more vibrant life. And we've got a little more exciting news as well. We are actually rolling out a brand new website at LifeWorksKC.com. This is where you're going to be able to find detailed protocols for supplements. You're going to be able to find articles on health resources. You're going to be able to get all of our information as to when the podcasts are coming out. There's actually a place where you can put your email in. You're going to get newsletters. You're going to get updates, everything you need, because our goal is to help empower you and get you moving in the right direction. What's really cool is some of our protocol supplements, they're going to manage well, they're not going to manage, but they're going to give you the data to help you manage your simple complaints. Okay, you've got some acid reflux, right? Go to our digestive health area, okay, under protocols, and you're going to see some supplements that you can take, and it'll give you the time, the amount, how much you should take, all that stuff that's in there. So it's really, really cool. Say you got joint pain. What would I recommend for joint pain? Well, the protocol is in there. How much, when to take, and it gives you a more specific tool that you can work on yourself, whether it's gut health, whether it is joint pain, whether it is blood sugar metabolism, allergies, okay? It's all in there for you, and we're going to continue to add to it. So it's important you get on our email list so that you can get these updates when they come. So I want to start today, and I want to ask you a question. Do you really, truly think we're healthy here in America today? So if you look around, so many people today are coming into at least my office. Maybe this is you, actually. But they come into our office, and I'll ask them, what medications are you taking? Okay, they can't even remember them. In fact, what happens is they come in with this sheet of paper, they pull it out of their wallet or their purse, and they unfold it about 8 times, and it pulls out into this big sheet of paper, right? And it's a list of all of the different medications they've had. You know, one of the things I learned a long time ago when I was in school, one of my professors said, hey, when you see everybody walking in one direction towards something, you need to question that. You need to ask why, okay? And oftentimes what you're going to find is that you need to go the opposite direction. I mean, look at the number of people right now that just walk towards medication. They walk to their doctor. They walk towards symptoms, okay? What you need to do is you need to take a look at that. Look at it in yourself and turn and walk the opposite direction. You see, this show exists to help you to think differently about your health. We want to encourage you to stop following the herd and start to take control of your own wellness. You see, you deserve to be empowered to make decisions, make the right decisions for your health, instead of feeling like you're stuck managing symptoms. Hey, this is the Freedom Health Show with Dr. Matt, and I want you to be sure to check out all of our episodes here on Apple Podcasts, Spotify. We're going to be here every week with you, and you can get all kinds of articles and resources and protocols actually on our website at LifeWorksKC.com. Now, let's dive into this medication thing, okay, because it's so problematic today. Medications absolutely can save lives, and medications, they're needed sometimes. We get that, right? However, here's where the problem comes in. They're often overprescribed and overused. In my professional experience, shoot, probably 80% of the time when medications are prescribed, if you just made a simple lifestyle change, you could probably prevent that problem or address that problem ahead of time. So while medications can be helpful, okay, and they can even get us out of some traumatic events where we need them, right? But in many situations, they should only be used for short-term use or short recovery, just to support and get you over that hurdle. The reality is, when these medications are used more than a few weeks, few months, okay, it impacts our body's natural physiological functions, and it can lead to serious issues. So one of the biggest problems that we have with modern medicine is that medications rarely address the root cause of health issues. You know, think about it. Most medications are designed to suppress a symptom. That's it. You know, that might give you temporary relief, but it's like putting a bandage on a deep wound without treating the underlying cause. You know, without addressing the root cause, you're setting yourself up for more symptoms, more inflammation, and eventually chronic health issues that could have been avoided. And here's another issue when it comes to medication is they're not always as effective as you think, okay? You know, there's certainly some great benefits and there's some great medications to help with that short-term recovery, but many times there are more effective natural options and natural solutions, such as diet change, adjusting your lifestyle, or just using proper supplementation. I'll tell you a story. Just this week, I had a patient come in to me. I had her on the adjusting table. I was adjusting her, and she gets up and she goes, oh man, my sinuses every morning are just congested, okay? And she's like, what can I do to help ease this up? So I went to the shelf, and there's one supplement that I use all the time when I start to get a histamine response in my body. It's called Antidepressants, okay? I love it. It's from Standard Process. And I said, just start to take 3 to 4 of these before you go to bed at night. I woke up the next morning. She messaged me on Facebook, and she said, holy smokes, I already feel the benefits from this supplement just by taking this before I went to bed. Cleared up her nose. She wasn't getting the bloody snot in the morning time, and it was great. And she didn't need a decongestant. She didn't need a medication. It's a supplement to naturally help support that liver, detoxify some of the histamines, and boom, she was doing great, okay? So if medications are going to be effective, they really should only be used for a short term, and then we can get to the root cause of the problem. So over time, though, they will lose their impact. In many cases, natural solutions can be a better long-term solution. But what really concerns me is how long people stay on these medications. And in my experience, most medications should not be used as long as they are if the necessary lifestyle changes in the beginning had been addressed and the real issue has been addressed. So while many times we'll see people on a medication for months, years, or sometimes even a lifetime, and when they've been on it for that long, there's a long-term damage and stress that's been done on your body, and especially the gut, which we're going to be talking about here today, okay? This can lead to inflammation that sets a stage for more serious health challenges. One of the biggest dangers of medications is their side effects. And many of these come with unpleasant acute side effects that when you get it immediately, or they're creating a nutritional deficiency over time, which develops into more serious challenges. So if you think about it, in your 20s, right? We go to college, we're just getting into life, probably not eating the best as we should. And as we're not eating very well, now we start to get a little bit of acid reflux. We get a little bit of allergy situation, right? So maybe we get an infection. We go get an antibiotic. We go get an acid reflux medication. Now, those medications cause deficiencies. So now we get into our 30s and 40s, and you've had these vitamin deficiencies and inefficiencies, for that matter, and it's creating chronic fatigue, it's creating anxiety, it's creating depression. And then we move into our 50s and we got full-blown diabetes. We've got anxiety. Maybe in our 60s it's Parkinson's, Alzheimer's, dementia. So you have to understand that it's what we're doing when we're young, before we have symptoms, that build to something later on. And unfortunately, we live in a society today that you don't do anything until you have symptoms, until you have a pain, until you have some sort of struggle going on. And that is, well, it's a good time to handle it, but it's also a late time to handle it as well. So now you're at this stage at older in life where now you're dealing with bags of medication, lists of medication, because you're handling the side effects from the medications. You're handling, the medications are handling different conditions you have going on. So instead of addressing the root cause with something that's natural earlier on in life, we oftentimes just get a prescription. And these medications start to counteract themselves, and they quickly spiral into situations where you're taking multiple medications, and you're in this place where your health has deteriorated to a very, very low level. And to make matters worse, many people are prescribed multiple medications at the same time. This is actually called something, it's called polypharmacia. Okay? And when you're treating a condition, and then you're treating the symptoms or the side effects of that medication, it can get dangerous. And oftentimes people aren't having this looked at. They have one provider giving them a medication for allergies, and another one giving them for a gut issue, and another one giving for this, and this. And nobody's bringing it together. And we end up with a slew of medications that we really don't know what we're doing with. So I'm bringing this up because what we're talking about today in particular is this big hit of medications on the gut and this disruption of balance of bacteria. It damages the gut lining. It leads to more chronic inflammation. And this creates this domino effect that impacts our digestion, our immune system, and then our overall health. So we're going to start to move into the 5 most common medications that people take that cause gut inflammation and disrupts a natural balance, okay? So to understand how medications really affect the gut, what we have to do first is we have to understand what a healthy gut does and what the roles are of that gut. You see, your gut breaks down food. It absorbs nutrients, and it keeps the immune system strong. So it acts as a barrier preventing harmful substances like bacteria, toxins, undigested food particles from entering into your bloodstream, okay? So way I say it is, think about it like this. Okay, so here's your gut right here, and we're looking down the tube of your digestive system, okay? Now, if we're going to fillet that open, okay, we should have tight junctions in between the cells, which I'm demonstrating as my fingers, as the cells of your digestive system. Now, as that inflammation comes in, it creates inflammation within those cells and opens up the gaps between the cells, so these toxins and bacteria and undigested food particles can now enter. So a healthy gut is when we have no or very, very little inflammation, and we keep those junctions of those cells very, very tight together. This, when it opens up, is actually called leaky gut. So when your gut is functioning well, it selectively allows nutrients to pass through while keeping the bad stuff, the bacteria, the viruses, the parasites, the undigested food particles, chemicals, and so forth, out. However, when this gut lining becomes compromised, the condition is called, what I said earlier, leaky gut. So those harmful substances get through the cracks. This can spread widespread inflammation that can lead to a whole range of problems, including food sensitivities, autoimmune issues, chronic fatigue, but one of the major culprits is just leaky gut. And long-term use of medications are a contributing factor to all this. Now let's take a look at some of the common medications and how they impact your gut, what nutrients become deficient, and how it affects your health over time. So we're going to explore how 5 of the most common drugs affect your gut lining, the nutrients that they deplete, and what happens when you don't get enough of these nutrients, and the compounding and domino effect of that. So one of the top medications that we run into, and that many of you have probably used, is ibuprofen or aspirin to relieve pain, relieve joint pain, relieve discomfort, relieve inflammation, okay? And they can be useful in short-term relief, but over time, these medications can wear down that protective mucosal layer in your stomach and in your intestines. So remember, you're inside that tube, okay? You've got a layer of mucosal. That mucosal layer protects the body, and it selectively So that mucosal layer that I was talking about that goes around the inside of the digestive system, that protects. That's a protective barrier, okay? And that's part of your gut lining, and it doesn't allow the bacteria, the toxins, the chemicals to get in. So if this becomes inflamed, the risk of becoming more, many people have probably used NSAIDs like ibuprofen, aspirin, pain relief medications to reduce inflammation and, say, joint pain, right? A headache. And these can be good and useful for short-term relief, but over time, these medications will wear down that protective mucosal lining that is in the stomach and in the intestines. So without that protective barrier, your gut lining becomes at risk and becomes more permeable to conditions like ulcers, gastrointestinal bleeding. Those are probably more the more serious ones that you're going to actually see. But then we start thinking of just the basic leaky gut. And you can have a leaky gut and not have some of your common symptoms that you would think about, diarrhea, bloating, but it can be creating mental challenges, so anxiety, difficulty concentrating, mood, even chronic fatigue. And what's even more concerning is the nutrient deficiencies that go along with the NSAID. So you take an NSAID in your 20s, maybe in your 30s, and you're on it for a period of time. This now creates a deficiency of a condition that you deal with in your 40s or your 50s or your 60s. So some of the deficiencies that start to happen with NSAIDs are your levels of folate, iron, and vitamin C. So when folate's depleted, difficult ability to be able to produce new cells, repair tissues, and it's going to lead to that thing called fatigue. And I'm telling you, there's so many people today that deal with chronic fatigue, especially in late 30s into your 40s, and then it kind of progresses into their 50s a little bit. I mean, think of what you've gone through at that point, right? High school, college, you went to the stress of getting into a new job, you're finally settled into the new job, and then you throw kids into the mix, or maybe you had your kids in your 20s, and then life balance was a mess, okay? You get through your 40s, and now you're just kind of in this zone, and you're in this path of just doing it. It's like automatic now, right? But your body's wearing down, and then you get into your 50s when things kind of start to let up a little bit, and you're beat down so much that this chronic fatigue is there. It can always also cause a lack of iron, so you're looking at issues like anemia. And vitamin C, and then vitamin C is going to slow down your ability to heal. It's going to weaken your immune system and leave you even more vulnerable to infections as we age, which leads me into the next one. What do we do when we get an infection? We'll take an antibiotic, okay? This is another medication that has huge impact on the gut. I know when I was young, I had a lot of antibiotic, okay? I'd get an earache, I'd get a throat infection, and first thing my parents got me on was an antibiotic. We went to the primary care, antibiotic, you know. We didn't know back then the harmful effects of this and what it was really doing to the gut like we do now, but we know now what it's doing, and so there's steps that we can start taking. You see, antibiotic, they wipe out the good and the bad in your gut, and this imbalance becomes known as a dysbiosis, and it can lead to leaky gut. It can lead to digestive issues. Have you ever heard your gut being called the second brain of your body? Well, your gut plays a huge role into mental health issues like anxiety, depression. It's called this gut-brain axis, this gut-brain connection, okay? And we're going to talk about that on further shows, but I love to always work on the gut because the gut is the foundation of so many areas in your health, okay? You know, antibiotics, they lead to deficiencies of certain nutrients, certain vitamins, B1, B6, B12, vitamin K. You know, your B vitamins are crucial in the energy production and energy levels of your body for brain function, for adrenal support, okay? It can also help regulate your mood. So without having the right nutrients in your body, you may be experiencing symptoms like fatigue, brain fog, irritability. This is why oftentimes when your gut's a mess, we'll actually dive into IVs with you in the office so we can bypass the gut, get right into the bloodstream, and get the nutrients where they need to be so they can start to build the body up so that your body starts to heal faster. And so these deficiencies, they put you at risk when early in life, but you don't really notice it until later on. Another medication that I see so many people, I don't even know the percentage of people that are on this. It's a lot today. And I've talked about this in other shows, and you can find this show on the podcast. So go back and look for it. But it's about acid reflux. Okay, acid reflux is a big one for a lot of people, and mainly is because our diets are trash today. The foods that we eat have very little nutrients. It's causing stress on our digestive system, and then the mental stress that we have contributes to that as well. So while these medications, they help to reduce the stomach acid, and that's what we think is like, oh man, I've got too much acid in my stomach, it's causing a burn, I got to reduce it. Wrong thing. Okay, with stomach acid being low, it actually causes more heartburn, it causes more challenges, it causes more issues in the body. Okay, your body needs that acid. Listen, your stomach is this huge sterilization tank. Okay, and so when foods and anything that comes in, it goes into your stomach first, it gets broken down, it gets sterilized, and then it gets moved along the path to digestion, right? So if you get a decrease in acid in your stomach, it's going to cause acid reflux, and you can get that on one of the earlier podcasts that I did. So the stomach acid is essential for breaking down your food, especially proteins, some absorption of certain vitamins as well, magnesium, calcium, vitamin B12, all diminish when you don't have enough acid. And magnesium is important because there's about 300 different chemical pathways that use magnesium. And so everybody should be on some sort of magnesium supplement. One that I like in particular actually is Easy Mag from Standard Process. Why do I like that one? Well, it comes from Swiss chard, and it comes from buckwheat, buckwheat flour. And I know it's not gluten. It's a plant that, and it's not a grain. It's the buckwheat plant. Okay, but when you have 4 Easy Mag a day, that's the equivalent of eating a pound of Swiss chard every day. So you can imagine all the nutrients that are in green leafy vegetables. Okay, and so this helps to supply a magnesium to your body to help with muscle cramps, irregular heart rhythms, anxiety, right? And then it's also got some calcium in it. So you kind of get 2 nutrients for 1 supplement, which is great. And it's highly absorbable because it's coming from its most natural state. And that's what I love about that. Not to mention that there's a ton of other minerals and nutrients in it as well. So Easy Mag probably is not a real great name for it because it's really a multi-mineral in many cases. Okay. And then when we talk about the gut and not having enough acid, well, you need that B12, and that's a nutrient that can go deficient when you don't have enough stomach acid. So now you're looking again at fatigue, weakness, even neurologic issues like memory, okay? And so what did we talk about? We've talked about antibiotic, we've talked about NSAIDs, and we've talked about proton pump inhibitors. Those are probably your 3 most common ones that I see, okay? But I'm going to add 2 more on. Corticosteroids, okay? We see this a lot in our office because we see a lot of people with joint pain. In fact, there's a lot of doctors that inject it into joints for inflammation. And I understand why, because it's a powerful anti-inflammatory medication, right? And it can give you very, very quick relief. However, that corticosteroid will actually break down that joint over time. The studies are out there. You just have to look for them, right? But when we take it orally, people may do it for asthma, autoimmune conditions, or severe allergies. And again, these can be very effective to take the edge off and knock it down quickly, okay? But you have to understand there's some long-term effects to that, okay? And if we did it short-term and then worked on getting to the root cause, you wouldn't have to be on these corticosteroids all of the time. So it can make it difficult for your digestive system to heal appropriately when we're always taking these medications, okay? Now, some important nutrients that steroids deplete: vitamin D, potassium, calcium again. So you got calcium, vitamin D, that comes to your bone health. So now you're on corticosteroids, you're putting your bones at greater risk for fracture, may develop osteoporosis, and potassium, quite honestly, is necessary for heart function. okay? Muscle function. And given that your heart is your biggest muscle of your body, you need good calcium and potassium levels. So these are all nutrients that are directly related to corticosteroids. And then let's talk about this last one, because this is one I see a lot of people on starting probably in their 40s. You know, they've been beat up the last 15 years of their life, maybe had some stressful situations. And these are antidepressants, SSRIs, Prozac, Zoloft. You know, they're prescribed to regulate mood. I get it, right? They alter your serotonin levels. However, serotonin isn't only found in the brain. In fact, about 80% of it, 90% of it is produced in your gut. So when you're stressed, what do you crave? You crave sweet things. You crave chocolate. Some people want alcohol, right? But some people want salty stuff. But what that does is it affects those serotonin levels, and that's why you crave those things. But this directly is going to create or contribute to a condition called leaky gut, or like leaky gut, okay? And so long-term use, you get deficiencies in sodium, folate. When you get these deficiencies, again, it just leads down this negative path: memory issues, mood impacts, cognitive function. And so now in our 60s, 70s, we're looking at Alzheimer's, dementia. We're looking at the big neurologic conditions that have broke down over time. So, like I said earlier, there's some short-term benefits to medications, and I get it. And many of you guys have probably used it like I have for a short term to get over a crisis situation, and that's what it's there for. But we got to get to the root cause, correct these issues so we don't get leaky gut, so we don't get nutrient deficiencies, okay? If we handle it appropriately in order to get the body healing right after you've taken this medication, then your body's going to be in a much better place long term. So always be proactive, because if we can be proactive, then we don't get into this reactive state of just chasing after symptoms and chasing and chasing and chasing. And sometimes it's not always easy, because some of you guys have been dealing with this stuff since your 20s, 30s, okay? So it takes time. It takes time to get this gut layer healing, and it takes time to allow your body to adapt. And once you've got this new way of living in and understanding this, then you're now protecting it, okay? It's this lifestyle change that you're now continuing on and allowing your body to thrive long term. You know, when I start working with patients, I always like to start with the gut, or have the gut first in mind. Why is this? Well, it's because the gut is a central component to nearly every aspect of your health. It's not just about digestion, but it's actually about getting the nutrients into the other systems so the other systems can run appropriately. You see, your gut is the first line of defense to your immune system. Nearly 70 to 80% of your immune cells are in your gut. And that means if your gut is compromised, so is your immune system. So it makes you more vulnerable to illnesses, infections, and inflammation. Your gut plays a vital role to this nutrient absorption. So even if you're eating a healthy diet, but your gut isn't functioning quite appropriately, you won't be absorbing these minerals, these vitamins, and other nutrients. So your body needs to have a healthy gut, and this can lead to deficiencies such as iron, B vitamins, magnesium, which can affect other things in your health as well, including your mental health. You see, your gut often plays a root role to chronic fatigue and mood disorders, okay? Even autoimmune challenges. And so the gut is closely related to the brain. It's what we call the gut-brain axis. See, when your gut is healthy, it helps the mood and stress and cognitive levels. About, like I said earlier, 80 to 90% of your serotonin level is actually produced in your gut. But when your gut is out of balance, it can lead to this anxiety, depression, and brain fog. And so your feel-good hormone, which is serotonin, is produced by the cells in your gut as a result of acid. And so when you have this high acid, it can be produced appropriately, and now your brain does not have to do all the work. So when your gut is struggling, your mental health often suffers. And this is the challenge. This is why so many people, are having these mental health challenges today, is because our diets are garbage. We're filling our bodies up with stuff that's creating gut inflammation. And also one of the reasons why I focus primarily on the gut first. So if I can handle the gut and we get that moving in the right direction, well, I know that fatigue most of the time is going to improve. Autoimmune issues are going to improve. Weight gain is going to start to go down because your body's going to be able to get rid of stuff. Think of your gut almost like a sewer. If you're not keeping that sewer clean, it starts to back up, okay? And the lowest part of that sewer is your colon and your digestive system. So if that's not opening, if you're not having bowel movements regularly, keeping those toxins coming out of the body, there's a challenge. And then when that backs up, then the next part's going to be your gallbladder and your liver. And gallbladder is one of the number one organs that are taken out today. And so if we're not opening up this gallbladder and getting this liver to detoxify into our digestive system and getting it out, that becomes a problem. And then if it backs up in our liver and our gallbladder, well, then our lymphatic system, which is the drainage system for our body, then becomes congested. And we may see things happening in our skin, okay? It's like, I give this analogy to patients. We put so much stress on our body for the simple things. And so let's say I needed you to run a mile, okay? And I said, in order to run this mile, you need to put on snow boots, snow pants, all your snow gear. Only what I'm not going to do is I'm not going to put skis on the bottom of your feet to go down a hill easy. We're going to put the snow boots on, and then I'm going to have you on a beach in Florida running in the sand. How difficult would that be for you to get a mile? Could you do it? Sure, you could do it. You could struggle through it. You'd get there. You're going to be hot. You're going to be sweaty. You're going to be fatigued. You're going to be worn out, right? There's a lot of interference to get to the end of the race. But then I said, okay, here, let's test this out. Let's take off the snow gear. Let's put a pair of gym shoes on and some workout clothes. I'm going to put you up on the sidewalk that's next to the beach, and I want you to go a mile. Could you do it? Could you do it faster? Could you do it more efficiently? Would you be as tired? Yeah. So now think of all the interference that you have in your body that's interfering with just normal healthy function, okay? Well, your gut is like that first place we want to start in order to keep that process clean, okay, and efficient. Okay, once you heal your gut, you lay the foundation of healing for the rest of your body. So remember that healing the gut doesn't happen overnight. A lot of times you guys have been dealing with this for 20, 30, 50 years or more. So you can't expect to reverse the damage in a few days or even a few weeks. Healing takes time, but it's one of the most powerful things that you can do for long-term health when it comes to your gut and your digestive system. So now that we've been talking about gut health, we've been talking about how 5 of the most common medications that affect the gut, they disturb the nutrient absorption and create deficiencies within the body, okay? So how do we go about healing this? Well, what we do is we use a process. It's called the 4 R's: remove, replace, repair, and rebalance, okay? It's a simple framework that you can go by in order to guide your path towards better gut health, okay? So let's talk about this first step, remove. You want to remove the things that are causing harm to your gut. Think of this as clearing out the clutter before you begin to rebuild. You want to eliminate the things, the processed foods, the sugars, the gluten, the dairy, the other common food allergens that can inflame your gut lining. But it's not just the food that we're talking about. We're also talking about environmental toxins, chronic stress, okay, harmful pathogens. I see people all the time with parasites, fungal overload, bacterial overgrowth, okay? It's very common and we forget about it. But a big one that people forget about is stress. Stress plays a massive role in your body, okay? If you're constantly in a fight or flight mode, it pumps out cortisol hormone and it can weaken your gut's lining over time. And this is why stress management techniques like meditation and breathing can be so critical. Even just getting out and exercising and going for a walk, that time to relax and allow your body to de-stress is really, really important. So getting rid of the bad bacteria, the pathogens, also very key. I'll oftentimes put people on like parasite protocols in order to get rid of some of this stuff. So if you have worked with somebody, then you know. If not, there's many herbs that are out there that can target these specific pathogens, bacteria, and clear them out naturally. Now, the second phase is replace. Once you've cleared out the bad stuff, it gives your body time to now start to absorb the good stuff. It needs to be able to digest and absorb the nutrients properly. This is where replace comes in. The missing element is needed for good digestion. So I had a patient come in this week. She has had a gastric sleeve. Gastric sleeve is basically they remove half of your stomach and they sew the rest of it back together so they create a smaller one, okay? And she's had her gallbladder removed. So immediately I'm thinking, okay, she probably doesn't have enough stomach acid in order to digest food, and she's not making enough bile from her gallbladder to digest good, healthy fats. And so she's going to have to support her body differently now in order to maintain that element of repair or replace, because her body doesn't make it anymore. Medications like the PPIs or antibiotics for a long time, they will suppress your ability to produce those enzymes, produce that acid, okay? If you have your gallbladder taken out, you're not going to be able to produce any bile to digest those fats. So we use supplements, and we use supplements like betaine HCl. It's a product I get from Standard Process. You guys will see that I use a lot of Standard Process, and I like Standard Process because they're all whole food vitamins, okay? And that's one of the things they've done for over 95 years is they focused on whole food nutrition, its most natural state, so it's absorbed differently in the body, okay? And this betaine HCl is important because it helps acid break down the food, absorb nutrients like protein, iron, and calcium. The digestive enzymes, these can also supplement to break down fats, proteins, and carbohydrates more efficiently. I have a lot of people on digestive enzymes. You know, as we age, we lose the amount of digestive enzymes that our body produces. So it's important sometimes to be able to supplement with that, okay? And some of these digestive enzymes, when taken on an empty stomach, will actually help to break down to systemic inflammation in the body. They're proteolytic enzymes, but they help other areas as well. So enzymes are a great, great thing. Some of the ones I may use from Standard Process are Multizyme, Enzicor, or Zypan, depending on what you have going on, okay? And then somebody may need bile salts if they have a gallbladder missing. And one of the ones I like to use with that when you're having a fatty meal is Cholecal. And in this stage, when you're getting these digestive tools in to help, okay, this is going to start that healing long-term with the gut. So now we move into the repair, okay? Got rid of the bad stuff, and now you're replacing the essential elements that are needed, okay? Now you want to repair it. And this is where the damage to your gut lining starts to heal, okay? We want to patch those holes up. Think of the highway. After a rough winter, you got all these potholes there, right? And they go and they patch the holes up. Well, in patching up those holes, we use nutrients to patch those called L-glutamine, amino acids that can help to strengthen and build those gut cells, okay? L-glutamine is a fuel that fuels your gut cells and allows them to heal and regenerate. Zinc helps to tighten up those junctions between those cells so that we don't get that leakage of toxins into the system. And collagen. Collagen is a great building block for strong gut tissue. Omega-3 fatty acids, they will also help to decrease inflammation and promote healing. Now, those are building blocks. What if we needed something to get it moving a little bit faster or a little more of a stimulant to get the healing happening? Well, this is where herbs can come into play, like aloe vera, slippery elm, marshmallow root, okay? And these can all be found in various Standard Process supplements that we use in our office all the time for our patients, okay? But these can soothe the gut, and these herbs help to reduce the inflammation and protect the gut lining faster and promote this healing. So incorporating these can be great to long-term support. And then we got to rebalance the system, right? Because you have a good bacteria that should be in there in order to help support and fight against the bad stuff, right? And having that good bacteria in there is critical. So probiotics, prebiotics to feed the good bacteria are very, very important. So how can we do this? How can we get this through diet even, right? And so this is where you're going to look at things like fermented foods, fermented vegetables, okay? You could get yogurt, kefir, sauerkraut, kimchi. These are all great things that have good bacteria in them. So you're going to fluorinate your gut with good quality bacteria, okay? And prebiotics, you could feed those good bacteria with prebiotics such as garlic, onions, asparagus, even bananas. Okay? But by rebalancing your system, now you're creating an environment for the good bacteria to thrive and helping your gut to function properly. So as your gut is healing and as this healing process is happening, it's going to take time. But when you commit to doing these 4 R's, remove, replace, repair, and rebalance, you're laying the foundation now. Okay? And you're laying that foundation to better digestion, stronger immunity, and better overall mental health. Okay? So you're going to set yourself up now for a long, healthy life of healthy gut, good brain, stronger immunity, and you're really going to start taking control of your gut health by using the 4 R's to replace, rebuild, repair, and remove, and get your body balanced again. Hey, thanks for tuning in today. I'm Dr. Matt, the Freedom Health Show, and my goal here is every week to bring you a little bit of extra data. Okay, a little bit of extra data for your health, some action steps to move forward so that you can continue on your journey of creating abundant health and living the life that you want. Getting out of the cycle of just treating the symptoms, not getting to the root cause of challenges that you've got going on in your body. Hey guys, I know it's not always easy, but with consistent and steady progress, you too can make these changes. So keep tuning in every week. And if you haven't joined our email list yet, go to our website, lifeworkskc.com, and scroll down to the bottom of the homepage and you'll see a place where you can put in your email so you will get updates on podcast information and healthy protocols that you can apply to your health.